iodide importer into the thyroid cells. So, you know, in the thyroid cells, in the screen share, why not? Sorry. So we were on the ionic inhibitors, and these are the group of drugs which inhibit the iodide trapping. And you know, this iodide is the precursor for T3 hormone synthesis, T4 hormone synthesis, or the thyroid hormone synthesis. And in the follicular cells, in the thyroid cells, there is the presence of the sodium iodide symporter, so which is responsible for transporting the iodide into the follicular cells, and this iodide gets oxidated and causes the formation of the iodine. And these are the group of drugs which inhibit the transport of iodide into the follicular cells by inhibiting the expression of the sodium iodide symporter. And these are the anions which resembles the iodide. So iodide is also the negatively charged compound. So these group of drugs are also negatively charged compounds, which include different drugs like thiocyanates, perchlorates, and nitrates. So these are the group of drugs that inhibit the iodide trapping into the follicular cells by inhibiting the expression of the sodium iodide symporter into the thyroid cells. And since this transport is inhibited, so T3, T4 hormones cannot be synthesized. And among these drugs, so perchlorates is most potent one, and it is 10 times more potent than thiocyanate in blocking sodium iodide symporter, whereas nitrate is very weak in inhibiting the symporter. And these are the toxic group of drugs, and hence we have very good drugs that are used in the hyperthyroidism. They are toxic and exhibits different forms of the adverse drug reaction. They are not clinically used now. So these ionic inhibitors are basically the group of drugs that are used in the hyperthyroidism as a historical importance. So continuing with the drugs that are used in the hyperthyroidism, we do have the iodine and iodides. And you know, this iodine and iodides, iodide and iodine are the precursor of thyroid hormone synthesis. So they are, this iodine and iodide causes the synthesis of T3 and T4 hormones. But it is kind of paradoxical effect when this iodide and iodine is given in high doses. So they inhibit the formation, they inhibit the synthesis, they inhibit the release of thyroid T3 and T4 or the thyroid hormones, and thus they are used in the treatment of hyperthyroidism. So these are the oldest remedy used for the disorders of the thyroid gland disorders. So iodide and iodine can be used for the treatment of both hypothyroidism as well as hyperthyroidism. So, you know, iodide and iodine is the precursor of T3 and T4 hormone synthesis. So they are used for the treatment of endemic goiter. So they can be used in the treatment of hypothyroidism as they are the precursor of T3 and T4 hormones. Whereas when this iodide and iodine are given in large doses, they also are used for the treatment. They can be also used for the treatment of the hyperthyroidism. And this action is known as a paradoxical effect. And that particular specific term for this paradoxical effect is known as the Wolff-Chaikoff effect. So we'll come on that. And I think you have already read this portion in your physiology classes as well. So though iodine is a constituent of thyroid hormone, it is a precursor of thyroid hormone. It is used as fastest acting thyroid inhibitor. And this is kind of paradoxical effect. And there is a reduction in thyroid hormone levels when large amount of iodine is ingested or intake. So this is the Wolff-Chaikoff effect, and mechanism of action of this effect is unknown. So the main mechanism of this Wolff-Chaikoff effect could be, so when excess amount of iodide is ingested, so it may inhibit its one transport into the thyroid cells by interfering with the expression of sodium iodide symporter on the cell membrane. So the main mechanism of Wolff-Chaikoff effect could be, so when higher doses of iodine or iodide is given So it may inhibit its own transport into the follicular cells, and by inhibiting the expression of sodium iodide sympater. So there would be less production of T3 and T4 hormones. And this iodide and iodine has different mechanism of action. So one of these mechanism of action is inhibition of its own transport into the follicular cells. And other mechanism of action could be it inhibits the organification, it inhibits the coupling process so that less amount of T3, T4 hormones is synthesized. And another mechanism of action of this iodide and iodine when given in larger doses, so it may inhibit the release of thyroid hormone into the blood. So all features of thyroid hormone seem to affected. So like inhibition of transport of iodide into the follicular cells, and also the inhibition of coupling and organification process. Similarly, inhibition of release of thyroid hormones into the bloodstream. But the most important action of this iodide and iodine is inhibition of the thyroid hormone release, which is known as the thyroid constipation. So the major effect of iodide and iodine is inhibition of release of T3 and T4 hormones into the bloodstream, which is known as the thyroid constipation. And in Graves' disease, which is one form of the hypothyroidism, so if this iodine and iodide are given in larger doses, so enlarged gland strings become formed and less vascular. So uses of this iodine and iodide, so as said earlier, they are used for the treatment of both hypothyroidism as well as the hyperthyroidism. But when they are used for the treatment of hypothyroidism, as for example, mainly in case of endemic goiter in which there is decrease in iodine intake, so low dose of iodine is given, whereas for the treatment of hyperthyroidism, larger doses of this iodine and iodide need to be ingested. So they are used for the preoperative preparation for thyroidectomy in Graves' disease. So iodine is usually given 10 days before proceeding surgery, because when iodine is taken, so it makes the thyroid gland less vascular and less firm, so that the surgical procedures will be easily be carried out. And they are also used for the treatment of the thyroidostorm, which is a severe form of hyperthyroidism, which is also known as thyrotoxicosis. For the treatment of this thyroidostorm or the thyrotoxicosis, which is the emergency condition of the hyperthyroidism, different form of therapies is done. So one of the therapy includes the iodine and iodide, because the main mechanism of action of this iodine and iodide is the inhibition of release of thyroid hormones. And as said earlier, they're also given for the treatment of the hypothyroidism, especially for the prophylaxis, as well as the treatment of endemic goiter. And they are also used as an antiseptic in the form of Lugol's iodine, in the form of the povidone iodine for different incision and drainage process. So coming to the adverse effect of this iodide and iodine, so acute reaction can occur. So acute reaction is mainly manifested as allergic reaction, and it occurs in the individuals who are sensitive to iodine. And different forms of allergic reactions like swelling of lips, eyelids, angioedema of larynx can occur, making the person difficulty for breathing. So fever can occur, joint pain can occur. And if acute reaction to iodine occurs, so further exposure to iodine should be stopped immediately. And chronic overdose, when these drugs are given for long period of time in larger doses, so chronic overdose can occur, so which is the iodism. And long-term use of high doses of this iodine can lead to the hypothyroidism in patients, so leading to goiter. And when they are given in pregnant women or the nursing mothers, so there is great chances of fetus or the children to become the hypothyroidism, that is the fetal or the infantile goiter, and hypothyroidism can occur in the fetus or the children. So another form of therapy for the treatment of this hyperthyroidism include the radioactive iodine. So in the radioactive iodine, isotope of iodine is given that emits the radiation. So isotope of iodine in form of capsule, in form of pill, or it's also available in powder form, which need to be mixed with water and then swallowed. And after the swallowing of this radioactive iodine, they are absorbed into the bloodstream, into the intestine, and now they get concentrated into the thyroid gland, which now destroys the thyroid cells. And this radioactive iodine has got both the diagnostic value as well as the therapeutic value. And for the diagnostic value, as for example, for the detection of different thyroid disorders, so usually low doses of radioactive iodine are used, whereas for the treatment purpose or for the therapeutic purposes, so higher doses of this radioactive iodine are used. So microcurie amount of 131 radioactive iodine has diagnostic value for evaluating different thyroid disorders, whereas in higher doses, that is millicurie amount of this radioactive iodine is used for non-surgical ablation of hyperthyroidism or non-surgical treatment of hyperthyroidism. So radioactive iodine is used for both the diagnostic value for diagnostic purposes as well as the therapeutic purposes for treatment and diagnosis of the thyroid disorders. And it has got a long half-life of 8 days. And when they are concentrated into the thyroid gland, so they emit both the rays, that is the gamma rays and beta rays. So this gamma rays is used for the diagnostic value, whereas the beta rays is used as a therapeutic value. So beta particles, which has the therapeutic value, that is the destruction of the thyroid cells, are utilized for the destructive effect on the thyroid cells and are used for the treatment of the hyperthyroidism. So this radioactive iodine, so 131 radioactive iodine is concentrated by the thyroid cells, by the thyroid gland, and they are incorporated within the colloid, in which there is the formation of T3 and T4 hormones, where they radiate the radiation within the follicles. So beta rays, which has the therapeutic value, acts almost exclusively upon the parenchymal cells of thyroid cells with little or no damage to surrounding or the other tissues. So therapeutic uses of this radioactive iodine, so as said earlier, they are used for treatment of different forms of thyroid disorders, especially the hyperthyroidism, as well as they have the diagnostic value. So they are used for the diagnosis of the thyroid function, thyroid disorders. And when they are used for the treatment of the hyperthyroidism, so higher doses are generally required for the treatment of toxic multinodular goiter than for the Graves' disease. So toxic nodular goiter is more severe than that of the Graves' disease, and it has poor prognosis than that of the Graves' disease. So usually higher doses are required for the treatment of toxic nodular goiter than that of the Graves' disease when this radioactive iodine is used as therapy. And the response is slow, and it starts 2 weeks after the starting of the treatment and gradually increases, which peak at 3 months. So advantages of using radioactive iodine over the other forms of drugs that are used for the treatment of hyperthyroidism. So it is the treatment is simple and inexpensive, unlike the surgery, which has a risk of damaging the surrounding tissues, as well as the use of other drugs, as for example carbimazole, methimazole, or propylthiouracil, which need to be taken for lifelong. So the treatment with radioactive iodine is simple and inexpensive. So there is no surgical risk and no scare or injury to surrounding tissues, as for example thyroid gland, recurrent laryngeal nerves. And once hyperthyroidism is controlled, so cure is permanent. So coming to the disadvantage of this radioactive iodine, hypothyroidism. So it can cause permanent hypothyroidism, and it may ultimately require supplemental thyroxine treatment or T4 therapy. And it has a long latent period of response. The response is not immediate. So as said earlier, it takes 3 months to reach the peak effect. So it has long latent period of response, and they are contraindicated in pregnancy as well as the nursing mother, because it has a high risk of causing infantile goiter, and they are not suitable for young patients because if it causes hypothyroidism, it can be permanent. So they are not suitable for young and the growing children. So coming to the other group of drugs that are used for the hyperthyroidism, so one of the therapy includes the beta adrenergic blockers, so which involves the different drugs like propranolol. So it could be cardioselective or non-cardioselective beta blockers. So the most commonly used beta adrenergic blockers for the treatment of hyperthyroidism includes the non-selective beta adrenergic blockers, which includes the propranolol. And in hyperthyroidism, so there is increase in sympathetic activity. So as for example, there is increase in pulse rate, there is increase in sweating, there is increase in palpitations. So these beta adrenergic blockers, they alleviate all the symptoms that is related to the sympathetic effect that occurs in the hyperthyroidism. So propranolol, so which is non-selective beta blockers, which blocks both beta 1 as well as beta 2 receptors, and other non-selective beta blockers as well. They rapidly alleviate sympathetic manifestations of thyrotoxicosis. So thyrotoxicosis or thyroid storm is the severe form of hyperthyroidism, which is emergency condition and need to be treated as early as possible. So these beta adrenergic blockers, they are used in hyperthyroidism. So while waiting response to propylthiouracil or carbimazole or radioactive iodine, because propylthiouracil, carbimazole, which are anti-thyroid drugs, as well as the radioactive iodine, so these have the latent response. So these drugs are used, beta adrenergic blockers are used while waiting response to these anti-thyroid drugs or the radioactive iodine. And they're also used along with iodide for preoperative preparation before thyroidectomy. And they are the major drugs for the treatment of the thyroid storm or thyrotoxic crisis or thyrotoxicosis. So they are responsible for inhibiting all the sympathetic stimulation that occurs in the severe form of hyperthyroidism, that is the thyroid storm or thyrotoxic crisis or thyrotoxicosis. So what are the treatment modalities that are used for the treatment of thyrotoxic crisis, which is a severe form of hyperthyroidism, which is an emergency condition and need to be treated as early as possible. So for the treatment of this thyrotoxic crisis, so we almost use all the drugs that are used in the treatment of the hyperthyroidism. We use all the combination of drugs that are used for the treatment of hyperthyroidism. So first of all, so we need to alleviate the sympathetic manifestations. So for that, we use the non-selective beta blockers like propranolol, and route of administration should be intravenous. And apart from alleviating the sympathetic stimulation that occurs with the thyroid storm or thyrotoxic crisis, they also inhibit the peripheral conversion of T4 to T3. Similarly, antithyroid drugs like propylthiouracil is used. So in antithyroid drugs, so there is also carbimazole, methimazole. So why this propylthiouracil is used? Because these are the group of drugs that inhibit the production of T3 and T4 hormones. So propylthiouracil has additional mechanism of action as well, that is they inhibit the peripheral conversion of T4 to T3. So propylthiouracil is preferred over carbimazole and methimazole. Similarly, iodine is used, so a high dose of iodine need to be used. So they causes the thyroid constipation, they decreases release of T3, T4 hormones. So iodine or iodides are also used. Similarly, corticosteroids, as for example, IV hydrocortisone are used. So they are used to tide over crisis, and also they inhibit the peripheral conversion of T4 to T3. Similarly, so there is increase in sympathetic activity. So there is increase in pulse, there is increase in heart rate. So propranolol, if not able to control this tachycardia, increase in heart rate, so calcium channel blockers like diltiazem can be used. And rehydration with IV fluids should be done, because there is excessive sweating. In case of thyrotoxic crisis, there is sympathetic stimulation which results in increase in sweating. So rehydration with the fluids, IV fluids need to be done. Similarly, the patient is associated with anxiety. So anxiolytics should be used. So external cooling measures should be used, because there is increase in sweating. So fever can be there. and external cooling measures should be used, and use of appropriate antibiotics should be also used if there is any infection. So these are the treatment modalities for the hyperthyroidism. त्यसमा सबभन्दा इम्पोर्टेन्ट भनेको चाहिँ नि so classification of drugs that are used for the treatment of hyperthyroidism, and you should not be confused when your examiner asks you, so what are the different treatment for hyperthyroidism and hypothyroidism. So basically for the hypothyroidism, so there is use of the thyroid supplements, as for example T3, T4, as well as the mixture of T3 and T4, where basically T4 is used, so levothyroxine is used. So, and for the treatment of hyperthyroidism, these thyroid inhibitor drugs are used. So, hypothyroidism, कति स्टुडेन्टहरूले चाहिँ नि what are the therapy for the treatment of hypothyroidism भन्दाखेरि चाहिँ नि यो ड्रगको यो क्लासिफिकेसन भन्छ, so which is wrong. So for the treatment of hypothyroidism, you need to give the thyroid supplements, and for this T3 therapy, so T4 therapy, or the combination of T4 and T3 is used. So however, for the treatment of hyperthyroidism, you need to say about this classification. So सबभन्दा important is now भनेको चाहिँ नि so classification, this classification, and exam mostly सोध्ने भनेको चाहिँ नि this about the anti-thyroid drugs, that is the propylthyracil, metimazole, carfilzomib, for mechanism of action, so adverse effect, as well as the difference between propylthyracil and carfilzomib. अनि अर्को इम्पोर्टेन्ट भनेको चाहिँ नि उफ साइकअफ इफेक्ट पनि हो, so which is the paradoxical effect associated with the iodine and iodide. अनि radioactive iodine is also important. Any questions? So continuing with the drugs that are used in the thyroid disorders, so we do have some MCQs respond to this. So T3 as compared to T4 is more plasma protein bound, is shorter acting, is less potent, has delayed onset of action. So which of the option is correct? Any other answer? So the answer is the B. So it is shorter acting when compared to T4. However, T3 when compared to T4 is less plasma protein bound. They are more potent, as well as they have quick onset of action. So the answer is B, that is T3 when compared to T4 is shorter acting. So coming to next MCQ. So carfilzomib when compared to propylthyracil is less potent, is shorter acting, does not produce active metabolite, does not inhibit peripheral conversion of T4 to T3. So which of the option is correct? Any other answer? So the answer is D. So both falls under the antithyroid group of drugs, that is the group of drugs that inhibit the production of the thyroid hormone synthesis, carfilzomib and propylthyracil. So carfilzomib and propylthyracil, when they are compared, so carfilzomib is more potent than that of the propylthyracil. It is longer acting when compared to propylthyracil. It produces the active metabolite, which is the metimazole. However, this carbimazole, when compared to propylthiouracil, they do not inhibit the peripheral conversion of T4 to T3. So propylthiouracil has additional mechanism of action, that is conversion of inhibition of peripheral conversion of T4 to T3. So the answer is D. So levothyroxine is indicated in thyroid storm, cretinism, endemic goiter, and Graves' disease. So which of the following statement is true, or option is true? Any other answer? So the answer is B. So levothyroxine is supplement T4. So it is T4 hormone, and they are the drug that need to be given for the treatment of hypothyroidism. So cretinism is the congenital hypothyroidism. So for the treatment of thyroidism, usually the drugs that are used for the hyperthyroidism is used. So combination of drugs that are used for the treatment of hyperthyroidism are used. So it is a severe form of hyperthyroidism which need to be treated as early as possible, as it is the emergency condition. So drugs that are used for the treatment of hyperthyroidism are used here. Whereas for the treatment of endemic goiter, so usually iodine supplements are given, and obviously for the treatment of Graves' disease, so which is again the other form of hyperthyroidism, so drugs used for hyperthyroidism are given. So cretinism is condition, so it is a hypothyroidism condition, so it need to be treated with T4 therapy or T3 therapy. So for that, levothyroxine is used in the oral form. Okay, so this finishes the drugs that are used in the thyroid disorders. So continuing with the endocrine system, so we'll be moving towards the corticosteroids. So we are starting with the new chapter, so which includes the adrenal hormones, and these adrenal hormones are basically the corticosteroids, which include different corticosteroids like glucocorticoids, mineralocorticoids, so androgens, some amount of the sex hormones, and these adrenal hormones, so they are secreted from the adrenal glands. So adrenal glands are two in number, which are situated above the kidney, and this adrenal gland has two parts. One is the cortex and the medulla. So cortex is the outer part, so which is responsible for secretion of different steroid hormones, so which includes the glucocorticoid, mineralocorticoid, and some amount of the androgens. And so inner part of the adrenal medulla consists of the adrenal gland consists of the medulla, which is responsible for secretion of different neurotransmitters. So especially the neurotransmitter that is released during the adrenergic or sympathetic response, that includes the adrenaline and noradrenaline. The major glucocorticoid that is released from the adrenal cortex include the cortisol, which is also known as the hydrocortisone, and mineralocorticoid that is secreted from the adrenal cortex include the aldosterone, and some amount of androgens are also released from the adrenal cortex. So I so you सबै थाहा छ हैन. So physiology ma pani padisakyo hola, aru subject ma pani padisakyo hola. So you know this also, hypothalamus is responsible for secretion of the cortisol releasing hormone, so which stimulates the anterior pituitary to produce the adrenocorticotropic hormone, so which now stimulates the adrenal cortex to release the different corticosteroid in form of glucocorticoid, mineralocorticoid, or the androgens, and higher amount of release of this corticosteroid decreases the production of ACTH from the anterior pituitary as well as the cortisol releasing hormone from the hypothalamus. And the precursor of this corticosteroids, so all the corticosteroids, including the glucocorticoid, mineralocorticoid, or the androgens, so precursor is the cholesterol, and they are synthesized in the adrenal cortex under the influence of adrenocorticotropic hormone. So coming to the pharmacological action, corticosteroids physiology ma cover bhaisakyo. Physiology ma cover bhaisakyo corticosteroids. Okay.
China, ma'am.
Hos. अरु कुनै सब्जेक्टमा Okay, fine. So we are moving towards the pharmacological actions of these corticosteroids. So corticosteroids, so main corticosteroids are of two types. So one is the mineralocorticoid, the other one is the glucocorticoid. So mineralocorticoid is mainly responsible for maintaining the fluid and electrolyte balance, and mineralocorticoid action is exerted by the aldosterone, and this aldosterone acts on the distal convoluted tubules of the kidney, and you know this aldosterone or the mineralocorticoid is responsible for the sodium reabsorption in the distal convoluted tubules, and when the sodium is being reabsorbed, there is resultant excretion of the potassium ion as well as the H+ ion. So when there is excess of this aldosterone activity or mineralocorticoid activity, there is sodium retention, whereas there is the excretion of potassium and H+ ion. So when there is excretion of H+ ion, hypokalemia occurs, and when there is excretion of H+ ion, alkalosis occurs because H+ has been decreasing from the blood. And when there is deficiency of this mineralocorticoid or the aldosterone, so opposite thing occurs. So kidney is not able to retain sodium, and hyperkalemia occurs, and acidosis occurs. So there is loss of sodium, whereas there is reabsorption of the potassium and H+ ion. So reabsorption of the potassium ion will lead to hyperkalemia, and reabsorption of the H+ ion will lead to the acidosis. So when there is deficiency, so fluid and electrolyte imbalance occur. And the main adverse effect of this excessive mineralocorticoid activity due to aldosterone is the sodium and water retention, which can lead to edema, so which can lead to hypertension. So one of the adverse effect of this glucocorticoid as well as the mineralocorticoid, overall corticosteroid, is the exaggeration of the hypertension as well as the exaggeration of the edema, and hence they are contraindicated in the patients who are suffering from the hypertension, who are suffering from the congestive cardiac failure, who are suffering from the edema. So mineralocorticoid activity which is exerted by aldosterone, so यसको चाहिने main function भनेको चाहिने it causes the fluid and electrolyte balance. So all the other effects that is caused by the corticosteroids, that is mainly due to the glucocorticoid action. So they do have the action on the carbohydrate, protein, as well as the fat metabolism. So in the carbohydrate metabolism, so glucocorticoid stimulates the glycogen deposition in the liver, and they also decrease peripheral utilization of glucose by the peripheral cells, and the net effect result in decreased sensitivity to insulin by peripheral cells. So peripheral cells will be not able to intake the glucose, and there will be increase in blood glucose level. As a result, hyperglycemia occurs and diabetes may be precipitated. And one of the adverse effect or one of the contraindication of these corticosteroids, especially the glucocorticoid, so it is the diabetes mellitus, because it decreases the sensitivity of peripheral cells to insulin and increases the blood glucose level. So they are also contraindicated in the patients who are suffering from the diabetes and hyperglycemia. So coming to lipid metabolism, so it causes the promotion of the lipolysis. It causes the lipolysis, and this lead to the release of the free fatty acid. And this free fatty acid, so usually lipolysis occurs on the limbs, so upper limbs, lower limbs, so which results in the thinning of the limbs. Whereas the resultant product of the lipolysis, that is the free fatty acid, gets deposited on the central portion of the body, so leading to this deposition of free fatty acid into the central portion, as for example, neck, face, and shoulders, which results in the moon face buffalo hump with thinning of the extremities, that is the limbs. So usually there is the lipolysis, and lipolysis occurs in the limbs, causing the thinning of the limbs, whereas the free fatty acid get deposited into the central portion of the body, causing the rounded or the moon face, similarly buffalo hump, increase in obesity. So similar to lipid metabolism, so which causes the lipolysis, so it also is catabolic in nature. Glucocorticoids are catabolic in nature. It causes the protein breakdown and causes the release of amino acid, mobilization of amino acid from different parts of the body, as for example, lymphoid tissues, muscle, skin, bone, etc. And if catabolic effect or the protein breakdown occurs in the muscle, so muscle wasting occurs. So in the lymphoid tissue, lympholysis occurs. Similarly, if catabolic effect occur in the skin, so thinning of the skin occurs. So there is easy bruising as well as the stress marks in the patients who are taking this glucocorticoid. And if catabolic effect occur in the bone, so it causes the loss of bone matrix leading to osteoporosis, and all these lead to the growth retardation. So electrolyte and water balance. So electrolyte and water balance is mainly carried out by the mineralocorticoid activity, whereas the glucocorticoid activity, glucocorticoid has also some role in the electrolyte and water balance. So they do have weak mineralocorticoid action. Glucocorticoid have weak mineralocorticoid action, and similar to mineralocorticoid, so they also causes the sodium and water retention and causes potassium excretion. And similar to mineralocorticoid, when they are given for a long time, so glucocorticoid can cause sodium retention, water retention, leading to edema as well as the hypertension. So calcium metabolism, so they decreases the blood calcium level, so they inhibit the calcium absorption in the gut, and they also increases the excretion of calcium, both leading to the decrease in blood calcium level. So in the bone, so as said earlier, it has catabolic nature, and it also decreases the bone forming cells. It decreases the number of the osteoblasts, whereas it increases the number of the bone resorbing cells, that is the osteoclast. So prolonged use of these drugs or glucocorticoids will lead to the osteoporosis and pathological fracture of the vertebral bodies. And this is the reason they are also contraindicated in the patients who are suffering from the osteoporosis, as well as they are contraindicated in the growing children, because they inhibit the growth retardation by causing the osteoporosis or the fracture of the bone. So cardiovascular system, so glucocorticoid, mineralocorticoid have sodium and water retaining activity, and you know the medulla causes the secretion production of the adrenaline and angiotensin. This adrenaline and angiotensin, they have the increase in pressure effect, and glucocorticoid has permissive effect on pressure action, so on the adrenaline as well as the angiotensin. So on chronic administration, so these drugs may cause hypertension, edema, worsening of the congestive cardiac clear. In the central nervous system, when these drugs are given in pharmacological doses, mild euphoria can occur, mild excitement can occur in the patient, whereas its deficiency causes the apathy, that is a lack of interest, and depression in those patients. And when they are given in higher doses, so they decreases the seizure threshold, and this is the reason they are also contraindicated in the patients who are suffering from the epilepsy, from the seizures, because the high doses decreases the seizure threshold. And coming to the blood cells and lymphoid tissues, so they increases the number of the RBC, they increases the number of platelets. So in the WBC, only the number of neutrophils are increased, whereas they decreases the WBC cells like eosinophils, basophils. So they also decreases the lymphocytes and monocyte count, and they also increases the destruction of the lymphoid cells. So they are used in the treatment of the lymphomas. And coming to gastrointestinal tract, so they inhibit the prostaglandin synthesis, they inhibit the prostaglandin formation, and prostaglandin has beneficial role on the gastric mucosal cells. They increases the bicarbonate formation, they decreases the gastric acid and pepsin secretion, they increases the blood flow to the intestine, to the stomach, so which have beneficial effect on the GIT. So this group of drugs, glucocorticoids, mineralocorticoids, or as a whole corticosteroids, so they inhibit the prostaglandin. And inhibition of prostaglandin means increasing the secretion of gastric acid, increasing the secretion of pepsin, decreasing the flow, decreasing the secretion of bicarbonate, so decreasing the blood flow to the intestine, to the stomach. So this may aggravate the peptic ulcer, and this is the reason. So they are also contraindicated in the patients who are suffering from a peptic ulcer, who are suffering from the gastritis. And they have very potent anti-inflammatory effects. So anti-inflammatory effect. So do you know the group of drugs which has anti-inflammatory effect? NSAIDs, right? So NSAIDs, so there are two drugs which has anti-inflammatory effect. One is the non-steroidal anti-inflammatory drugs, and the other is the steroidal anti-inflammatory drugs. So steroidal anti-inflammatory drugs ma obviously yo corticoids haru parne bhayo haina. So when you compare the potency of these NSAIDs and steroidal anti-inflammatory drugs or corticosteroids, which are known as corticosteroids, so it is always the corticosteroids which is very much potent than that of the NSAIDs on term of anti-inflammatory effect. So usually in cases of inflammation, usually NSAIDs are used, right? So although these steroidal drugs or corticosteroids are very much potent than that of the NSAIDs, they are not used as anti-inflammatory drugs because of its adverse effect. So यो हामीले जुन corticosteroids पढिराखेको छौं जसमा mineralocorticoid, glucocorticoidहरु पर्छ. So they have very vast clinical uses, clinical indications, but it is the adverse effect that limits the use of these corticosteroids in different forms of therapy. So they have very vast indications, uses. They can be used in almost all the disease, these glucocorticoids or corticosteroids, but they have very wide range of causing adverse effects. So हामीले चाहिँ यो corticosteroids युज गर्दाखेरि चाहिँ एकदमै 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 cautious हुनुपर्छ, ध्यान दिनुपर्ने हुन्छ because of its adverse effect profile. So it prevents or suppresses the clinical features of inflammation. And when you compare the mechanism of action of these NSAIDs and corticosteroids, it's different. So NSAIDs basically inhibit the production of cyclooxygenase, so it inhibits the COX, whereas this corticosteroids, so it acts on very first step of the inflammation, that is, it inhibits the formation, it inhibits the production of the phospholipase A2. So when the production of phospholipase A2 is inhibited, so membrane phospholipid cannot be converted into arachidonic acid. So both the COX and cyclooxygenase and lipoxygenase enzyme is not formed. So these corticosteroids acts on very first step of the inflammation by inhibiting the phospholipase A2. So it induces a protein called lipocortin. So lipocortin is responsible for inhibiting phospholipase A2. So as a result, membrane phospholipid cannot be converted into arachidonic acid, and there will be no cyclooxygenase pathway, there will be no lipoxygenase pathway. It also inhibits recruitment of different inflammatory cells at the site of inflammation. So coming to the another effect of corticosteroids, so they have a potent immunosuppressive effect, and they result in impairment of both cell-mediated as well as humoral mediated immunity, and they suppresses all kinds of hypersensitivity reaction, allergic reaction. So hypersensitivity reaction or treatment got the carry. So you can see corticosteroids as one of the mainstay of the treatment of hypersensitivity or the allergic reaction. Whereas the severe form of hypersensitivity, as for example, type 1 hypersensitivity, which is known as the anaphylactic shock. The anaphylactic shock was a main drug used in because it's adrenaline, but corticosteroids like ibuprofen is also used as one of the therapy in the treatment of hypersensitivity or allergic reactions. So since they have the immunosuppressive activity, they are used for the treatment of autoimmune disease, as for example, myasthenia gravis, so SLE or जसमा चाहिने autoantibodies form भइराखेको हुन्छ against normal cells, against normal tissues ma. So they are used for the treatment of autoimmune disease in which there is exaggerated immune response by the host, and they are also used in graft versus host disease. So when the organ transplantation is being done from the donor to the recipient, so recipient might usually exaggerated immune response. So to suppress those exaggerated immunity, they are used for the treatment of graft versus host disease in case of organ transplantation. So we'll be continuing the rest of the corticosteroids in the next class. So any question? Any question? So if not, so I'll be ending the class for today. Thank you.